Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of Earwax. Thank you for joining me in yet another demonstration video of our recently developed wax scope, which is due to be launched in early autumn 2022. So if you are interested, please do email info@clearwax.co.uk and we shall add you to our mailing list. So we have a patient here who attended with bilateral, fully occluding, dark plugs of wax and dead skin. You can see there's a lot of keratin here, and I'm using our 4.25mm speculum attachment. So the speculum is used to dilate and widen the ear canal. We've got a smaller size speculum, which is a 3.5, and also two larger ones, a 5mm and a 5.75mm if required. And where the wax scope differs to our flagship product, the iClearScope endoscope, with an endoscope, the clinician is having to use the tip of the endoscope not only to examine the ear and the earwax, but also to straighten and widen the ear canal. And with the wax scope, as you can see here, you're using the speculum, so it's a bit more user-friendly. Now, the view, you can see the view's magnificent here in terms of the clarity and magnification. With an endoscope, that does offer you a wider field of view, but the view you get with a wax scope, I would put it on, I could compare it to an ENT microscope. In terms of wax removal, you can see how defined and clear it is, and you just adjust the focus. So that's the patient's right ear cleared, so this is the patient's left ear. Now, they do have narrow ear canals, so instead of using the endoscope to widen and dilate the ear canal, using the speculum as you would for microscopic earwax removal or microscopic earwax removal using head loops. So again, just using the Zollner suction probe here, just trying to detach this wax. It's quite adhesive and sticky just from the base, and I'm just now wriggling it out slowly but surely. The left ear was quite a lot more, not only narrow, but quite bendy in comparison to the patient's right ear. So we've got the occlusion out. I'm just going to go in, just want to have a quick nosy around. So you already see the eardrum in the distance, but I've just adjusted the focus because there's a bit of keratin just on the roof, very lateral. So just trying to remove some of that. And I think there was some just here as well, just posteriorly and inferiorly, just very lateral again. So with the wax scope, you adjust the focus on the object that you want to remove, and that also gives you the depth perception. So this keratin was quite sticky and adhesive, so I think I left a little bit left because it was non-problematic. It wasn't going to cause an issue for the patient, so we just wanted to avoid any clarinetting. So, and I think it was clarinetting there at the bottom. So just a little bit more at the roof. And once we've cleared that, I'm going to get a view of the eardrum again. You'll see how we just adjust the focus so you can see the drum. So once more, I'm going to dilate the ear canal to the right, then angle it back to the left, and then we're just going to adjust the focus, and that's the patient's left eardrum. You can just see how clear and magnified that is. And that's the plugs from both ears. You can see they're quite dark, so they've been there for a while, they've oxidized. Well, I hope you enjoyed that video, and once again, if you are interested in the wax scope, please do feel free to email info@clearwax.co.uk.